Thank you so much for the introduction. Sterile inflammation is a common event. It either triggered by a physical event such as TBI, chemicals such as autoimmune disease, or a metabolic ischemic injury stimulus. And all these non-pathogenic stimuli can cause cell stress, and it leads to a cascade and the release of damage-associated molecular patterns such as ATP, interleukins, or heat shock protein that, by binding to TL receptors, they activate NF-kappa beta pathway, and this leads to the release of pro-inflammatory factors. So to see the changes the neurovascular unit undergoes, we, using very low acoustic pressure, 0.3 megapascal, we did sonicated rats and performed proteomic analysis at different time points after pFUS. And this is actually the proteomic data. On the left, you can see the heat map of elevated cytokines and chemokines, the trophic factors, the activated elements of the immune system. And most importantly, HSP70 goes up at 5 minutes post-pFUS. That is important in mitochondrial dysfunction and mild injury, and along with IL-1A, IL-1B, IL-18, and TNF-alpha, it indicates a sterile inflammatory response in the brain. And together with the histological results, it also confirms the sterile inflammatory response, including DNA damage, astrogliosis, microglial and endothelial cell activation. So the question arises, what kind of cells are tunnel positive, and therefore we did co-staining with GFAP and NUN, and the answer is that most of the cells are neurons, with the minority being astrocytes. And to see if there is a secondary effect of these changes in the brain, we pre-treated rats with fluorescent beads IV to label systemic macrophages, and 6 days post-pFUS, we see the elevated numbers of CD68 positive and fluorescently labeled systemic macrophages migrating from the periphery to the brain. And this is actually a secondary effect of the first, for the primary proteomic changes. And afterwards, we went on and we did intravital microscopy in mice. And you can see the astrocyte and feet come off the blood vessels within the first 15 minutes post-pFUS, and they go through apoptosis, which is concerning. Whereas microglia, instead of migrating to the site of injury, it sends cell projections to the small capillaries to maintain BBB function. And this is actually an ATP-driven purinergic response, because besides the DAMs, damage-associated molecular patterns, ATP is also released from injured cells, and as a chemoattractant, it attracts microglia cell processes, and therefore microglia also takes part in repairing this blood-brain barrier leakage. So a low-intensity pulse-focused ultrasound microbubbles leads to a blood-brain barrier opening with the release of damage-associated molecular patterns that drives a sterile inflammatory response, and this could be associated with transient vasospasm or reperfusion or shock wave originating from acoustic cavitation of the microbubbles. And thank you for your attention.